enjoyed your lunch, and we are happy you are back. And so, talking about our conference, the first part of it was dedicated more to theoretical knowledge, to some pathways of our non-communicable diseases, and the second part of the conference is mainly dedicated for the practical questions. And now I would like to introduce our next speaker, Dr. Michael Klaper, who is a really gifted clinician who has over 35-year experience on the field, who is a passionate consultant and also educator for different professions, for physicians and for other medical professionals. And he strongly believes that plant-based raw food diet is very good medicine, and it eradicates the roots of chronic diseases, not merely treats the symptoms. So let's welcome Dr. Michael Klaper and listen to his presentation.
Thank you very much for that nice introduction, and thank you all for the invitation to address this remarkable gathering. It's so wonderful that you all have an interest in this very, very important subject. And I want to thank my Lithuanian hosts who invited and transported me here. And I'd like to recognize the Lithuanian health community, from the government to the academic people to the clinicians, dietitians, etc. For a little country, you put my big country to shame as far as your willingness to confront these very, very important issues. And you relegate my nation as the #1 exporter of disease-producing foods in the world. And it's a lesson for us as well. And so I just wanted to acknowledge your forward thinking. I also, however, as I get into my personal experience on how I conduct lifestyle medicine practice, recognize the particularly daunting challenge that Lithuanian clinicians have here. Lithuania has a unique position among EU nations. It's the country with the shortest lifespan, and it's largely due to Lithuanian men have a propensity to smoke cigarettes and drink alcohol, eat a lot of meat, and this reflects itself in shorter lifespans and a high suicide rate, actually. Suicide is the third highest cause of death in Lithuania. And this reflects some deep-seated cultural issues in Lithuanian society, which I honor. Heaven knows we have similar chords in American society as well. But clinicians here have quite a challenge ahead of them. I just want to point out a bit of urgency to that as well, in that this unusual graph, the dots here, this is compared to the entire experience in the EU nations. The further away the dot is from the center, the more extreme the particular parameter manifests itself. Here we have binge drinking adults is significant here. Obesity is starting to increase as well. Smoking adults certainly leads as far as EU statistics. What caught my eye and was most worrisome is drunkenness among 15-year-olds seems to be quite elevated, as is smoking among 15-year-olds. And what the fathers do, the sons pick up on, it seems. And it's just a cautionary note that there's lots of work to do on many levels here. That said, I want to bring you into my particular journey, where I have been practicing lifestyle medicine for the past 35 years. Where did all that start? Well, it started at Vancouver General Hospital in Canada in 1981. I had been in general practice for 7 years in suburban Vancouver after doing my internship at Vancouver General, and was getting so frustrated that none of my patients were getting healthier. They were just getting more obese and sicker and hypertensive and diabetic, and I really didn't know what to tell these folks. And out of desperation, I decided to leave general practice and become an anesthesiologist. And so I was an anesthesia resident at Vancouver General in 1981. And as you can see, I have not changed a bit. Being an anesthesia resident put me in the operating room, and when I was on the cardiovascular service, day after day I'm watching surgeons operate on the patients I put to sleep, and they open up their arteries, and from their arteries they pull this yellow greasy gunk called atherosclerosis out of their arteries, as this is a material that occludes the blood vessels and leads to heart attacks and strokes. And I had a great interest in this disease because my father already was showing signs of clogged arteries. His leg was turning blue, he was having angina. I knew clearly that I was at risk for being the next patient on that table with that striker saw going up my sternum, and I did not want that to happen. And so I needed to find an alternative to avoid that fate. And I already knew. One day I was watching the surgeons pull out a particularly yellow, slithery piece of atherosclerosis material from an artery, and I thought to myself, man, that stuff looks like chicken fat. And a little voice on my shoulder said, there's a good reason why it looks like chicken fat. It is chicken fat. And cow fat, and pig fat, and the fat of every other slow animal that was walking past this man's table when he had a fork in his hand. And I knew that that was going to be my fate as well. And I already knew what to do. There were already studies in the book. Fred Ellis had published in 1977 his report of a patient with severe angina, had to stop every 9 or 10 patients due to chest pain. He started on a plant-based diet, and 6 months later, his pain was much improved, and later in the year he had no angina after strenuous efforts. And 10 months later, he was climbing mountains in the Lake District of England. And it was very clear that a plant-based diet had a remarkable ability to clear out arteries. So I decided to adapt such a dietary style. It wasn't much of a jump. I had porridge and fruit for breakfast, lunches and dinners of big colorful salads, hearty vegetable soup, big plates of steamed green and yellow vegetables, stir-fried vegetables, lots of fruit for dessert, and no portion control. I just ate till I got full. Well, my body just loved this. Within 6 weeks, a remarkable change happened. Actually, in 10 weeks, I had lost 10 kilograms of body fat. My high blood pressure went to normal, my high cholesterol normalized, and I felt great waking up in a nice, lean, light body every day. So much so that I decided I did not want to be an anesthesiologist and spend my time putting people to sleep. I'd rather go back to general practice and help them wake up. So I did. So I left general practice, and so I left the anesthesia with 6 months to go in my residency, much to my parents' dismay. And went back to general practice. But this time I knew what to tell my overweight, hypertensive, diabetic patients, as I found someone who was giving plant-based cooking lessons in the community, and I would send the patient to them. And if they would maintain the diet, the same amazing changes happened to them, and the weight went down, and their blood pressure came down, their cholesterol came down, and I could stop their medications. I stopped their insulin, stopped their beta blockers. It was an exciting, it still is, an exciting kind of medicine to practice. I'm the happiest doctor I know because my patients get healthy, right in front of my eyes, and right in front of their eyes as well. And it really is a revolutionary kind of medicine that's garnering lots of attention, though it really shouldn't be. This is just what happens to people. And I worked for 8 years on the staff at TrueNorth Health Center in Northern California. We're about an hour north of San Francisco. And people come in with the standard Western diseases, the obesity, diabetes, hypertension, clogged arteries, a lot of inflammation. We put them on a whole food plant-based diet, and within days, the obesity starts to melt away, and the arteries open up and the high blood pressure comes down and the joints stop hurting and the asthmatic lungs stop wheezing so much and the migraine headaches go away and the psoriatic skin clears up and the bowels start working and they turn into normal, healthy people who don't need a lot of medications. This is Emily. I knew her well when she looked like this. 11 months on a plant-based diet. She was on 40 units of insulin. This Emily turned into that Emily. This Karen stopped the meat and the dairy and the oils and the sugar, and she turned into this Karen. And Philip here was a practicing diabetic, almost 100 units of insulin. And a year later, he's off his insulin and he's running marathons. This is lifestyle medicine at its best, and this is what's supposed to happen. And I tell my patients I want to see you in two places, and two places only, at the health food store buying your tofu, and on the bicycle path where I'll wave to you. That's the only place I want to see you. And ideally, they shouldn't have a whole lot of need for my services, and that's just fine with me. So what kind of lessons have I learned over the past 35 years of clinical practice? Well, I've learned that the body is not capricious. It doesn't decide one day to whip up, I'm going to whip up lupus today. I think I'm going to have a pulmonary embolus today. The body doesn't do that. It is a mechanistic organism that reacts to specific causes, and diseases generally are a result of violating some natural law. If you put diesel fuel inside your gasoline burning engine, you're going to cause problems there. It's the wrong fuel. You're violating the natural law that governs the function of that engine. Well, the same thing with our body, of course, and none of this will be a surprise to any of you sitting out there, but the violation of the natural law and common sense usually comes from unhealthful food, as our previous speaker just laid out for us. As well as not getting enough rest, not drinking enough water, not moving enough, not spending time out in the sunshine, not having enough love and support, and just living a lonely, meaningless life with lots of stress and being angry about it. This is the recipe to cook up all sorts of diseases and problems in your body. And as a wise professor of mine in medical school once said, you know, people don't get diseases, they earn them. And that's an appropriate way to look at the general process here, which spawned in me a deep appreciation for the power of time and the power of persistence. The Grand Canyon in Arizona was cut by the Colorado River day after day after day after day. So it's happening as we're speaking right now. This is the power of persistence. And the same thing happens in our body, whether the force is one that's going to generate health or one that's going to generate disease. If it's present constantly, day after day after day, it exerts its effect. And I'm going to explore some of those mechanisms with you in a minute. And of all the chronic shaping forces that we expose our body to, there's none, as far as I can see, as powerful as the food that we eat. So let me get real for a minute. Let's talk about the chemistry of food and what it really does. When I was in medical school, I have 4 lectures in nutrition in 4 years. Nutrition for burn patients, nutrition for kids with growth retardation, nutrition for patients with renal failure, and nutrition for people with Tsutsugamuchi fever. I can't even remember what the last lecture was. But nobody in 4 years sat me down and said, do you know what the effect of your patient's daily diet is having upon their body and these diseases? Nobody mentioned that to me. Well, I'm going to mention what I wish someone had told me. I'm going to share it with you. When you enjoy a whole food plant-based meal, that's how hopefully you just did, and you eat a meal like this, nice big salad, a hearty vegetable soup with beans, here's quinoa and zucchini boats, here's steamed green yellow vegetables. When you eat a meal like this, and if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I drew 5 cc's of blood, and I let it sit in the glass tube for an hour, this is what it would look like. The red clot goes to the bottom, the liquid part of the blood goes to the top, and this is the serum, and it should look crystal clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a meal. This is what hopefully all your blood look like now, unless you slipped out to McDonald's when no one was looking. They do that in our country. This is normal physiology after you eat a meal. But you have a standard Western meal, you have bacon and eggs for breakfast, or a cheeseburger and a milkshake for lunch, fried chicken or pizza, etc. You eat a meal like this, and all the heavy fats in the beef, the butter fat in the cheese, the egg yolk in the mayonnaise on the bun, the vegetable oil in the fries, the butter fat in the milkshake, all this fat oozes out into your blood. And for the next 5 hours, your blood looks like this. This cloudy material here, this is lipemia, this is postprandial lipemia after you eat a meal, and this means fat in the blood for those uninitiated signs of it, and this blood is fatty. And I was serious about the 5-hour number. Now, not everybody shows it this optically densely. But everybody has a wave of fat that goes to your bloodstream after you eat a fatty meal. How can you not? Where else is it going to go? Of course your blood turns fatty. And that 5-hour number is a real number. Here is Kuo's classic study. They gave someone a fatty meal at hour 0, and they drew blood once every hour for 6 hours. And they took those 6 blood tubes and put them one after another into a spectrophotometer to measure how milky, how fatty the blood is appearing. And you can see the blood getting fattier and fattier and fattier and fattier and fattier. It takes the liver a good 5 hours to begin to clear the fat out of the bloodstream. Well, think of what that means if you eat in the style that most Americans do. I can't vouch for Lithuanian eating habits, but I think they're probably similar. But people start their morning off with something fatty, bacon and eggs, egg McMuffin, something like that. And for the next 5 hours, their blood is running thick with fat. And during this time, all sorts of metabolic mischief is happening. The walls of the arteries, the endothelial linings are getting injured and ripped up and allowing the beginning of atherosclerotic inflammation to happen. As the fat goes through the abdominal fat stores, it sticks there, increasing abdominal obesity. That in turn increases one's insulin resistance, moving you down to diabetes. Then these saturated fats are pro-inflammatory, so inflammatory reactions throughout the body get fanned. This lasts for a good 5 hours. We have breakfast at 8 o'clock. At noontime, the fat from breakfast is just beginning to get cleared out of the blood by the liver just in time for lunch. And people send another wave of fat through your bloodstream. And all afternoon, the arteries are getting injured, the fat store's increasing, the insulin resistance getting worse, inflammation's getting fanned. It takes the liver till about 6 in the evening to clear the lunchtime fat out of the bloodstream, just in time to visit the colonel. And it's Lithuania. We're not going to visit the colonel here. We're going to eat sausage here and cheese. And that sends another wave of fat through the bloodstream. And the blood stays fatty all evening. Sometimes they eat fried chicken. Sometimes they visit the colonel here. But it takes the liver till about 10 o'clock at night to clear all this fat out of the bloodstream, when on the way back to the bedroom, people stop and send another wave of fat to the bloodstream. And the reality is, when you open the door of your clinic, the waiting room, the emergency room, outpatient surgery, etc., the vast majority of people sitting in that waiting room waiting to see you have blood that looks like this. This is the truth of the American bloodstream, and I expect the Lithuanian bloodstream is fairly close. Most people are keeping their blood fatty all day. Stuff never clears out of the bloodstream. You keep your blood fatty 30 years, 40 years, you can't be shocked when all sorts of pathology starts showing up in the body. Because there's more than just fat in this blood. There is an evil brew of molecules that cause pathology to blossom in every organ system. There's a lot of sodium in fast foods and prepared foods, and all the salt and the chicken and the fries, etc. Not only stiffen the artery walls and make you retain fluid, both of which raise blood pressure, but we're now understanding all this sodium sets off genes that predispose to autoimmune diseases. All the sugars that people eat, Now, I'm not talking about a teaspoon of maple syrup in your tea. That's the proper use of these flavorings as a flavoring. I'm talking about eating sugar as a food. When you're eating a candy bar, a donut, a cookie, you're eating a chunk of sugar as a food. And when you eat the sugar, it bathes your tissues, and all these sugar molecules stick to proteins all over the body. They glycosylate proteins, which makes them stiff. The Maillard reaction that happens when you bake bread happens in your proteins throughout the body. If it happens in the eye, it sets you up for cataracts. If it happens in your skin, it sets you up for skin wrinkles. The arteries in your brain, if you run the Maillard reaction in those artery walls, it's hard for oxygen to get through your tissues. This is what's in the bloodstream after you eat a sugary treat. Now, the salt and the sugar that I mentioned are problematic substances. And you can get them all from vegan junk foods. And if you're living on soft drinks and energy bars and sugary cereals, you can get yourself in real trouble and create an unhealthy body even on a plant-based diet. And that's why we emphasize whole food plant-based. None of this is obviously whole food, even though it's officially vegan. And so just because something's vegan doesn't necessarily mean it's healthy. That caveat recognized, I do want to spend a minute about the reality of what happens if your diet is based upon meat, which most people on planet Earth, certainly in my country, in this country, that's the truth of their diet. A meal is not viewed as complete unless there's a piece of animal muscle in the middle of the plate. And if it's not there, hey, where's my protein, man? And, hey, where's my piece of chicken, or etc. Most people consume a flesh-based diet, and every meal has a piece of animal muscle in it. Let's look at the realities of that. Nobody is eating raw meat. The very act of cooking animal muscle is going to oxidize cholesterol. Oxidized cholesterol molecules are highly atherogenic particles. These are the particles that work their way into the walls of the arteries and set off atherosclerotic plaque formation. And you inevitably create oxidized cholesterol on the grill or in the broiler every time you cook animal muscles. So you set yourself up for atherosclerotic processes just by cooking the meat. But also, cooking the fat and the protein in the tissue of the animal is going to oxidize those large molecules into some nasty aldehydes, malondialdehyde, acylacylene. These are nasty molecules that mutate your genes, and they will injure the substance of the DNA and maybe increase the risk of cancer, birth defects, etc. But everyone who's eating cooked meats is taking in a good shot of these aldehydes. They're also taking in a good dollop of new 5-GC. What's that? This is a sialic acid. That's nasty stuff. This is only found in animal muscle. Only mammals make this stuff. And this is highly pro-inflammatory. If you stain for it, you will find new 5-GC in the materials, in the plaques and coronary arteries and the joints of patients with rheumatoid arthritis. And our paleo friends are giving themselves a shot of new 5-GC 3 times a day. Everyone who's eating a meat-based diet is doing this. One reason why inflammation is so rampant. Then we got to deal with the endotoxin. What is endotoxin? Those of you who've ever spent any time in the intensive care unit or emergency room know endotoxic shock. This is a lethal condition that damages blood vessels and organs throughout the body. Where does it come from? It comes from the slaughterhouse. And every piece of meat passes through the slaughterhouse, including organic, grass-fed, pasture-raised meat. They all wind up passing through the slaughterhouse. So what? Well, the reality is that every cutting surface in the slaughterhouse, where the large pieces of meat are cut up, they all have a thin layer of gut bacteria from the animals. As they eviscerate the cows and the pigs, etc., the gut bacteria wind up coating every cutting surface in the slaughterhouse. And so every piece of meat that's cut upon the surface is going to have a surface film of nasty gram-negative bacteria, E. coli, Pseudomonas, Proteus, Salmonella, Shigella, Enterobacter. So what? Well, this is on the surface of the meat, gets wrapped up in that nice cellophane and shipped to your supermarket, where it sits in the meat case underneath the ultraviolet light hour after hour, and that ultraviolet light is there to do what? To kill bacteria, and it does. And when these bacteria die, their cell walls break up, and their cell walls release this nasty lipopolysaccharide called endotoxin. This is nasty stuff. Take a little cruise around this daisy of distress, and you'll see all the things that endotoxin does. It generates free radicals, it makes your platelets sticky, releases histamine, releases inflammatory interleukins, sets off blood clotting, nasty stuff, endotoxin. And endotoxin is heat stable. Cooking the burger does not get rid of the endotoxin. And again, our paleo folks who give themselves a shot of endotoxin 3 times a day. Well, endotoxin has not only these lovely effects, but it also makes your gut leaky. It allows molecules in your food to start leaking into your bloodstream and flow through joint membranes, kidney membranes, etc., setting off inflammation throughout the body. And this is the reality of folks who have a flesh-based diet. Another reality that our meat-eating friends have to deal with is TMAO from carnitine. What is that? The food you eat determines the microbes that live in your gut. You eat a bunch of sugar, you're going to summon up sugar-eating microbes. You eat a flesh-based diet, you're dropping big bolts of carnitine and choline from eggs down into your gut 3 times a day. And as a result of the carnitine and choline going down into your intestine, you're going to summon up a population of microbes that eat carnitine and choline. They have names like Streptococci and Clostridia. And they don't care about you. They're just waiting for that next piece of chicken or salmon to come down. And because they will turn the carnitine and choline into trimethylamine. So what? Well, your liver will oxidize that into trimethylamine oxide. This is a molecule from hell. This drives cholesterol into the artery walls and promotes plaque formation and keeps HDL from removing the bad cholesterol out of your plaque. And I've already had one paleo guy with ripped 6-pack abdomens drop dead on the treadmill at age 49 at the gym. Oh, he looked so healthy, but inside he was an old man, because this is not the right fuel for human beings. Like putting gasoline in your diesel engine, you're going to summon up problems that clog up your fuel lines here. And that's certainly what happens to our flesh-consuming friends. And very active cooking animal muscle is going to reduce the proteins in the muscle into some nasty carcinogenic hemicyclic amines. And these are nasty carcinogens. And they rub on the intestinal mucosa and they set off cancers. And due to the anatomy of the large intestine with these outpouchings, these haustra, they're going to hold the fecal masses covered with carcinogen in the same place every time. And as a result, as the months and years go by, you keep rubbing these carcinogens on the same part of the colon wall. It's no surprise that our meat-eating friends wind up with carcinomas in the descending and sigmoid colon. Although there's a clear connection between red meat and smoked meat consumption and gastric cancer as well. Finally, the animals in the feedlots are fed bushels of grains every day that are sprayed with herbicides and pesticides. And as the animal, the cow, the pig, the chicken is in the confinement lot day after day eating these grains, these toxic molecules accumulate in the animal's muscles and fat. The water that they're fed has heavy metals, lead, mercury, cadmium, arsenic, mercury, and the animals are fed substances to make them grow bigger, hormones and antibiotics. This winds up in the flesh as well. And so, again, not surprising, is like putting diesel fuel in a gasoline burning engine. This is a contaminated fuel. And this is the reality of people who eat a standard Western diet based on animal muscle. They gotta get that protein, right? And that drives all this. Well, if you're a clinician, realize that if you are sanctioning, and I'm not blaming anybody, I'm not waving any finger, this is reality because I did it for years. If you sanction this kind of diet, or if you promote it, if you ought to be eating paleo style, it's good for you, you ought to be eating ketogenic diet, if you are sanctioning this kind of diet, then you're saying it's okay for you to keep these molecules, the carcinogens, the mutagens, the endotoxin, the pro-inflammatory molecules, all the, keep these in your bloodstream hour after hour, day after day, month after month, year after year. Keep these molecules flowing through every tissue in your body, long term. And then we're shocked when the patient shows up with, oh, your arteries are getting inflamed and clogged up. Oh, your kidneys are all inflamed from all this animal protein soaking into your glomeruli. Oh, your joints are getting inflamed and your leaky gut allowed all these molecules to go through your tissues. Oh, that we're surprised. Ooh, how did this happen? Gee, well, come on. The body's not capricious. It didn't decide to just cook these diseases up one day. If you have a little bit of logic, look at the reality of the fuel that you're running through these tissues. Do you know the circulation time in the body, how long it takes a drop of blood to go from the peripheral vein out through the heart and back out to the periphery again? Anybody remember that from first year physiology? 12 seconds. Okay, that's the circulation time in the body. That's how quickly the body's in touch with itself. And that has profound ramifications, which I'll tell you in a minute. And yet when you get these, when you look in the textbook for the cause of these diseases, or you ask the professor, what's the cause of hypertension? What's the cause of hypertension? We don't know. Etiology unknown. But don't worry, the smart guys in the laboratories at NIH and Harvard are working 24/7 to figure out the molecular mechanisms. And when they've come up with it, they'll invent amazocillin, and you'll give that to your patient and restore them to magical health. Ain't going to happen. That's not what's causing these diseases. But if you don't know what the cause of the disease is, then you can't cure it. And so that reduces the physician to managing chronic disease. We can't cure your diabetes, but we'll manage your diabetes. We'll manage your high blood pressure. We'll manage your inflammatory joint disease. I don't know about you. I did not go into medicine to manage chronic disease. I wanted to cure people. And every single one of these diseases is curable. They're all reversible diseases, every single one of them. But we don't tell that to our patients. We say, all I can do is manage your disease, and implied in that is you're going to be sick the rest of your life. You're going to be a long-term professional medical patient at this point. You will never get better. Well, that's a heck of a message to deliver to your patient. And that's a heck of a framework to practice medicine for 20 years, but nobody's going to get better. Because these are chronic diseases of unknown origin. All we can do is manage them. Etiology unknown? Really? Come on. We know very well what's causing these diseases. It's what we're eating and how we're living our lives. We are eating and stressing ourselves into these diseases. And there's some very solid science behind it. Welcome to Camp Stop Kidding Yourself. And I share that with my patients. I tell them, listen, your body is never, okay. You know, you can't tell your body, look over here now. Look at that, I didn't do anything. Who are you kidding? Your bloodstream knows, your liver knows, your arteries know, your body knows. Stop kidding yourself. And doctors, let's stop kidding ourselves behind this etiology unknown label. And it's most blatant when it comes to artery disease. Every 30 seconds in my country, someone grabs their chest and falls over with a heart attack. Every other one of them dies. And the cardiologist, we don't know the cause of it. Must be high LDLs. And once it starts relentlessly progressing, nothing you can do to turn this disease around. And the implication is that, well, you were just given a liver that puts out this bad LDL stuff. There's nothing we can do, but we'll give you these statin drugs that poison your liver's ability to make this LDL, and hopefully we can slow the disease down. That's modern cardiology. And they focus in on these numbers, man. What's your particle size? What's your LDL number? What's your ratio of total cholesterol, HDL? Numbers. They cardiologists have become these fear-filled technicians ricocheting off these numbers and trying to get those numbers down, hopefully to help the patient, but in my country, they also don't want to get sued for not having you on statins when you have your heart attack. I have to ask my cardiology colleagues, all the physicians, what's the reality? That your patient with these clogged arteries is really they got a rogue liver putting out LDL. Is your patient keeping these molecules in their bloodstream day after day with your blessings or not? Because that's really what's driving these arteries to form this plaque. And so again, welcome to Camp Stop Kidding Yourself. These folks are focused on the numbers. Atherosclerotic plaques are not just globs of grease to stick to your artery walls because your LDL is too high. These are inflammatory lesions. These arteries are being injured. Meal after meal of fried animal protein, vegetable oil from the French fries, high fructose corn syrup from the drinks, phosphoric acid in the cola drinks, the endotoxin, all the stuff that's coming up from the gut are injuring these arteries. And that allows those oxidized LDL particles to get in the walls of the arteries and set this off as an atherosclerotic plaque. This is not just a matter of how high is your LDL, let's lower your LDL. Ask the owner of the arteries, how are they treating those arteries? This is artery abuse. If a patient is hitting themselves in the head with a hammer and complains about headaches, you don't just give them an aspirin. Stop hitting yourself with a hammer. Well, same thing. These arteries are getting inflamed. How are you treating those arteries? What are you doing to this precious endothelial lining here? That's the real issues. Again, Colorado cut the canyon in Arizona day after day after day. These destructive foods, day after day, injure the artery walls and set off this plaque formation. Well, the patient shouldn't be a victim. When one goes on a whole food plant-based diet and you bathe the artery walls with these plant-based nutrients, wonderful things happen. These phytonutrients are stabilizing, they're antioxidant, they promote tissue repair, they give the tissues the chemical message, shh, calm down, everything's okay. And as a result, these phytonutrients start penetrating into the walls of the plaque, neutralize free radicals, they allow the inflammatory macrophages to outmigrate. As a result, the plaques get smaller and smaller and smaller. The endothelial lining reestablishes itself. And those of you who've seen Dr. Estelson's fishes already know this one by heart. But if you're new to it, this is bad coronary artery disease. This is a patient's left anterior descending artery in their heart. The whole dye column should be this wide going all the way down. But this skinny area here with the rat-eaten portions here, these are atherosclerotic plaques that are encroaching into the bloodstream dye column. And this is where the problem lies. The cardiologist couldn't even put a stent in. This artery was so clogged up, and the surgeons wouldn't touch him. There was no place to plug the graft in down below. So we went to Dr. Esselstyn, put him on a whole food plant-based diet. 22 months later, this artery turned into this artery. This is a reversible disease. These plaques melt away under the guidance of a whole food plant-based diet. Not 100% of them, and we can talk about the fine points of dealing with individual patients. But the reality is that this is another one of these eminently reversible diseases. Here's a myocardial perfusion scan. Again, arteries are clogged up. Red blood flow is good here. There's very little of it here. Went on a whole food plant-based diet. Arteries dilate, plaque starts melting away, and in 14 days, this perfusion scan turned into that perfusion scan. The changes happen quickly, and arteries all over the body open up, and much to the delight of everybody at the house. So this is a novel concept. I've been a physician 47 years. Wasn't until about 3 years ago somebody put these two words in the same sentence for me and realized these are all reversible diseases. We are not teaching our young medical students this, to say the least, which is something I'm trying to remedy. But not only are these diseases reversible, but because they're mostly diet-driven, diet and lifestyle-driven, we never ask about it. Patients come in with all these problems, the high blood pressure and clogged arteries, etc., and we ask them to take their family history, medications around this and that. But do we ever sit them down and say, what do you eat? Take me through a typical eating day. What do you have for breakfast, lunch, and dinner? So it's never discussed. It's like in the Harry Potter movies, the arch enemy Voldemort, the name that must not be spoken. Oh, yeah. Don't ask about the patient's nutrition. Ooh, don't ask about that. And don't ask what they're eating. Yes, ask them about what they're eating. That's why they're sitting in front of you, overweight, diabetic, hypertensive, clogged up, and inflamed. It's from what they're freaking eating. And yes, have them take you through their eating day. It's outrageous because it's so primordial. It brings us to the diagram my friend Asher Montgomery, a cardiologist in Houston, made that said, from the tree trunk of bad nutrition symbolized by our fast food meal here, all this evil fruit of obesity and high blood pressure and heart failure and diabetes sprouts out. It's not all that complicated. But my colleagues make it complicated. And they put themselves in the same position, I'm talking about the medical specialists, as the classic folks in the blind man and the elephant fable, where a group of blind men stumble on an elephant, and this one grabs his tail, so the elephant's like a rope, this one grabs his trunk, the elephant's like a snake, this one grabs the leg, the elephant's like a tree trunk. They all have a hold of the same live elephant. None of them have the faintest clue what a real whole elephant really is. Well, that's the problem with our medical practice and our specialists these days. They're all sitting in their little cubicles thinking etiology unknown. The cardiologist sees the high blood pressure. The internist sees the clogged arteries. The endocrinologist sees the type 2 diabetes. The physiatrist sees the inflammatory arthritis. The rheumatologist sees the lupus. The neurologist sees the strokes. The dermatologist sees the psoriasis. The gastroenterologist sees the colitis and the Crohn's. The general surgeon sees the diverticulitis. Guess what? They're all looking at the same disease. They all think etiology unknown. Yeah? I'll tell you what the etiology is. What your patients are eating. And they're all analyzing the various side effects of this centrally generating cause of all their problems. But they don't want to look at that. They've got to ask the patient what they're eating. They've got to do something with the answer. And it makes them look at their own diet because they're eating the same stuff. And the cardiologists are eating the burgers and the pizzas, and they don't want to tell the patients don't eat bad stuff. And so round and round it goes. And it's sad because the patient loses and so does the physician. Because the truth is, you get these folks on a whole food plant-based diet, and most of these diseases go away quickly. It's quite remarkable. And I wish someone had told me what I'm telling the medical students when they go lecture at the medical schools, that appreciate that our food is chemically alive. What does that mean? It means that within minutes of eating anything, molecules of that food are flowing through every cell in your body where your DNA lies unfolded. And those food molecules wash through your cells and across your DNA molecules, and they play your DNA like a piano. And these food molecules turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal changes you on a genetic, molecular level. In this digital age, we can't be shocked to realize that food brings in not only nutrients, it brings in information. And it changes us. The science is called nutrigenomics. And it includes the study of how your food turns your genes on and off. And our food changes us, and it turns our genes on and off. Here's the patient with early prostate cancer. These red patches here, these are turn-on oncogenes that promote cancer. went on a whole food plant-based diet. 6 months later, these oncogenes turned into these oncogenes, the same patient, but a healthy plant-based diet turns these oncogenes off. Every meal changes us. And you don't need to be a geneticist to understand that the genes are going to be turned on by this fuel mixture, and all the contaminating molecules that every mouthful brings into your cells, the genes are going to be turned on by this mixture, are going to be fundamentally a different set of genes than those going to be turned on by this fuel mixture. This, in computer land, is the difference between 1 and 0. This is an entirely different set of genes going to be turned on, and again, these molecules bring the message stabilization, tissue repair. This is not to be ignored, because we ignore this at our own peril, because this is where early aging lies. This is where inflammation begins. This is where autoimmune diseases get their start. This is where cancer initiation happens. Every meal changes us for good or for ill. We have to all take responsibility for that. As the physician, I need to share with my patient, and me as an eater in a restaurant, I need to take this into consideration. Every meal changes us. Your body is never not looking. It really makes a difference. When you're eating a whole food plant-based diet and you're washing these molecules through your tissues meal after meal, day after day, week after week, month after month, you're bathing your tissues in these molecules. It changes who you are. And this is where free radicals get absorbed by the antioxidants. This is where tissue repair happens. This is where healthy immunity spawns. Every meal changes us, and it changes us in 2 ways. It's going to change us either directly, as the new 5GC molecule turns on the inflammation, it changes us directly chemically. But also, as we've heard today, the food changes the microbes that live in your gut, and they will change you in a number of, by a number of mechanisms. Molecules getting into your blood find their way into your nervous system, through the vagus nerve. There's various mechanisms, but food changes us. And welcome to the 21st century practice of healing patients. You have to take this into account. Changing the food stream to one mostly or completely based on plant foods. You don't have to be a complete vegan, and I don't use the V word. It confuses patients to dietitians, generates unnecessary resistance, and it's not medically, physiologically necessary. If you eat a small piece of meat once a week, twice a week, I don't think anything bad's going to happen, and you're free of all the baggage that goes with the V term there. But the majority of food going down your gullet. If you eat 3 times a day for 7 days, there's 21 meals in a week. If 19 of them are purely plant-based and 2 of them have a little piece of meat with them, the fact is you're eating a whole food plant-based diet, and the changes are just stunning. What we see. And it's one of the highest points in medicine to have a patient who walked in like this, and 4 months later they walk in the office, give you a big hug, and you barely recognize them, and they got a shine in their eyes, and they are so happy because they are off their medications. So, as far as practice guidelines, get excited when a patient comes into you. Another obese diabetic, hypertensive. Man, no, this is a chance to work some wonderful clinical magic, and it helps these people save their lives. You're about to witness one of the most spectacular transformations in all of medicine. And I tell the young docs in America, where the money flows so easily in the hospital, if you treat patients with chronic diseases, before you order another $1,000 scan, another $500 set of blood tests looking for some genetic mismatch on gene A21 on chromosome 14, stop. Ask your patient what they ate yesterday. Have them take them through the eating day. And if it's full of buffalo wings and burgers and French fries and soft drinks, that's all you need to know. Stop and get this person some help, which we will talk about. One thing I learned is never count anybody out. you never know who hears what and who's willing to make the changes. And people like Ken come into my office, and it's easy to write these folks off. This guy, he's never going to change. And he's not listening to what you're saying. He's checking his phone for the ball scores while you're talking to his wife. This guy's a write-off, right? You never know. You never know who hears what. This patient deserves counseling, and at a minimum, even if you don't think he's into it, he deserves a one-page handout on the way out the door, and I'll be glad to show you mine. It's a two-page handout now. But hey, Ken, you want to get rid of your diabetes? You want to get rid of your high blood pressure? You want to get rid of your lupus? You want to get rid of your sore joints? Here, go through this handout. See the videos that are recommended there. I've got a simple day of eating there. Eat lots of soups and salads and greens, etc. You can come back and see me in a month. And if you have any problems or you need a little guidance, then go see Miss Jones, the plant-based dietitian down the hall. Yes, I said the word plant-based dietitian. Now, we have a bunch of them in the States. I'll show you them in a minute. When I mentioned this to one of my hosts here, she rolled her eyes, and so are the dietitians. And they said, the dietitians are not your allies here yet. They think, especially when it comes to plant-based, vegan diet, oh no, vegan diet bad, oh babies die, you get all weak, scrawny, bad, vegan, oh no, don't do vegan, anything but vegan diet. And this is what you run into from the dietetic community. If that's true, then we all got some work to do, because this is a time for challenge and for growth of the dietetic profession. They're like the doctors, their specialty has shifted under their feet. And 2016, the position in the Academy of Nutrition Dietetics. It's the position of the Academy of Nutrition Dietetics that appropriately planned vegetarian, including vegan diets, are healthful, nutritionally adequate, and may provide health benefits for the prevention and treatment of certain diseases. These diets are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adults, and athletes. This is the reality of plant-based diets. The dietitians they're stuck in the 1950s if they're afraid of allowing or promoting their patients to nurse themselves on plant-based foods. As much as they would like to ignore it, it's like trying to keep a hat pin in a cloth bag. Point comes out. And the same thing is the truth of this. And it's time for dietitians in Europe here and in this country to get on board and to know what the American dietitians know. Well, I've been going to the medical schools in various cities. And when I'm in each city, as I'm getting my lecture together, whatever city I'm in, I do a quick Google search on plant-based dietitians. I don't even use the word vegan. I type in plant-based dietitians. When I was in Detroit lecturing at Wayne State, punched in plant-based dietitians, look who showed up on the screen here. And every single one of them, this word is vegan, 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 vegan. I didn't ask for it, this is what the computer found. Okay? But they proudly, and all of them have RD after their name. These are official registered dietitians, every single one of them. And they'll be more than glad to do the plant-based counseling for you in our state. I was in Rochester, New York, University of Rochester, plant-based nutritionists and plant-based dietitians in Rochester, New York. Plant-based dietitians in Seattle, Washington. Plant-based dietitians near Miami. Plant-based dietitians in University of Florida in Gainesville. For the dietitians in Lithuania, oh no, bad stuff. The plant-based diet, evil, bad. That's 1950s thinking. It's time for them to get on board, because the dietitians have such an important role to play, because it takes away the doctor's excuses. The doctors may say, well, yeah, there are probably some to this nutrition, but I don't know anything about nutrition. I don't have time to counsel these patients. I got 7 minutes for each patient. I don't have time to get into this. You don't have to, doctor. All you need to do is recognize there's someone sitting in front of you who's obese and diabetic, hypertensive, and clogged up from what they're eating. You send them to the plant-based nutritionist, let her do the counseling, and you see the patient back in a month. That's all you got to do. Just make the referral. And that's why the dietitians need to step up and play their legitimate role here and stop being a drag and an antagonist. We need them on the team. And they need to understand that they're going to get left behind. This freight train has left the station already. This is UC Davis, and there they are teaching plant-based eating as a journey of a lifetime there. And the biggest for-profit insurance company in America, Kaiser, they know that if only 10% of their patients adopted a plant-based diet, the billions of dollars they will save in chests not open, in ICU beds not occupied, scans not ordered. And so here they are telling their patients telling their doctors to recommend a plant-based diet. We need the dietitians to step up and play their rightful role. So why don't they? What are they afraid of? Because there's fear behind their opposition. In my opinion, they're afraid of this guy. I tried to eat a vegan diet once. It didn't work for me. My body needs animal protein. And they feel that Mr. Lithuanian guy here, man, he needs meat, man. We gotta have that meat for the muscles there. And that gets us into the whole paleo philosophy that I really have to stop for a second and share my thoughts about it. The dietitians are, well, you gotta have meat. You need meat to make good muscle, right? I would point out to them, remember your biology. And the truth is that the biggest, most powerful animals on planet Earth, elephants, buffaloes, giraffes, gorillas, grow to thousands of pounds of mammalian muscle without ever eating cheeseburgers or pepperoni pizzas. All the rippling muscle in these magnificent creatures were made out of the amino acids that grow out of the ground in plants. Every single one of them, wild grasses, grains, legumes, etc. You do not have to eat a bull to be as strong as one. Well, they're buffaloes. They're supposed to be big, but we guys, man, we gotta have that. We gotta have meat for our muscles. If they believe that, then I would invite them to fire up their web browser and their search engine and type in 3 words, plant-based athletes, and see who shows up on your screen. Do any of these lovely men and women look protein deficient to you? I know most of them are lovely people. I just want to point out, here's Jim Morris at age 61. Here's Jim Morris at age 71. I'm 71, I look just like that. That's what plant-based nutrition will do for you. But people say, well, I went on a paleo diet, I lost weight, man, I feel good. Yes, you do. You start off on this diet and you will feel better and you will lose weight if you've been eating the standard diet. Why? Because the paleo folks recommend 3 things that I agree with. They say that no paleo caveman ever milked a dairy cow, so they're down on dairy products. Yay, paleo, they're right. They say that no caveman ever squeezed the fat out of olives, so they're down on corn oil all over their food. Yay, paleo, they're right. And they say no caveman ever ground wheat into flour and made donuts and coffee cake, and so they're down on flour products. Yay, paleo, they're right. And you eliminate the dairy, the oil, and the flour products from your diet, man. If you're overweight, you're going to trim down. Yay. And that weight loss is going to make your lipid panel look much better, going to make your tissues less insulin resistant, your blood sugars will get better. Wow, yay, paleo, it's the way to eat, right? And this is what's being promulgated out there. As a physician, and I would hope all of you, whatever initials you have after your name, know that there are some profound problems with this eating approach. It is so unnatural. We have the same digestive system that our gorilla and bonobo cousins have, and they're up in the trees eating leaves and fruits. We're the same kind of food we ought to be eating. We have fingers, not claws. We've got big, long digestive tubing like the herbivores do. Our saliva contains starch digesting enzymes, not protein digesting enzymes. We are plant-burning creatures. But you pack this intestinal tract full of meat 3 times a day. Well, you're going to keep yourself in chronic ketosis. And remember, ketones are acidic. We're talking about beta-hydroxybutyric acid, acetoacetic acid. These are acids. And so this is a chronic acid load, month after month after month. This is hard on the kidneys, hard on the liver, hard on the bones. This is this degree of acidosis on a steady level is not healthy for the body. All this meat brings in lots of DNA that's going to turn into uric acid and set these folks up for kidney stones and gout. High protein diets are toxic to the kidneys. And I stress this to the bodybuilders, to the folks who are trucking down these protein smoothies. We're meant, again, to get our amino acids out of whole grains, whole beans, etc. But when you eat bolts of meat or these protein powders, all those amino acids slam into your glomerular filtration membranes. This is not a healthy thing to do. Every good nephrologist knows that you've got someone in pending renal failure, you put them on a low protein diet because protein is toxic to the kidneys. And these folks are putting bolt after bolt of protein through their kidneys, they're writing themselves a ticket to the dialysis machine. The carnitine that I mentioned spawns the TMAO, the endotoxin, there's your leaky gut. All the methionine in the meat will turn into homocysteine. They can damage your arteries, increase the risk for dementia. Someone asked, "How, doc, I want to cause a colon cancer. How do I do it?" Oh, pack a colon full of meat 3 times a day. Let that grow on your colon wall for a decade or 2, see what you set off in there. And they're going to wind up diabetic from all the fat that's clogging up their insulin receptors. This is not healthy. This is a diet of death. And these folks may feel good to start with. And when you're 25, you can eat linoleum blue and not get away with it. But these folks who are eating this kind of diet, I think, are setting themselves up for a plague of colon cancer, clogged arteries leading to heart attacks and strokes, autoimmune disease from the leaky gut, diabetes from all the high-fat diet. The microbes that are going to spawn and rip up their gut wall, give them Crohn's disease and colitis and dementia. This is a diet of death. And realize that the folks who are recommending these diets, and I talk to the young residents at the hospitals who see these folks in outpatient clinic, so you're only going to see these people once or twice. You're not, and you tell, oh yeah, be on a paleo diet, man, eat lots of meat, eat that protein. I told them, you're not going to be around in 5-7 years when that patient who's following your advice passes that bloody stool from his colon cancer. You won't be around to see that. When that patient 10 years later has his joints light up from his leaky gut, you won't see that. When the patient has his stroke or his MI from the vascular disease, you're not going to be around to see that. This hit and run advice. You've moved on. But meanwhile, these patients got real live diseases from this advice you've given. Do no harm applies to dietary advice as well as medicine and surgery. And you can hurt somebody with this diet. Because and I'm not talking about you individually, but us health professionals, you don't really know what you're saying when you say, yeah, eat this for 30 years. We know what a whole food plant-based diet will do. There's lots of people on this planet who've been eating whole food plant-based diets and make it to 100, hence the blue zone phenomenon. We know that plant-based diet is compatible with long life, but nobody's done these paleo diets for 30 years and has any idea what's happening. There's probably not a lot of people living who've done that for 30 years. Plus, it's so distressing to hear these folks recommending this diet. What are they talking about? Oh, everybody ought to be eating paleo, it's the best diet. Are they seriously recommending a flesh-based diet 3 times a day for 8 billion people on this planet? That will destroy life on this earth. It takes 15 planet Earths to create that much animal flesh. And as Susan pointed out earlier today, large-scale industrial animal agriculture is the driving force for every single environmental destructive force we face. This is why the forests are being cut down to make grazing land and cropland for beef. The soils of Minnesota, Illinois, and Wisconsin are eroding off corn and soybean fields into the Mississippi River. American topsoil is flowing into the Gulf of Mexico at the rate of a dump truck load a second, coming off the fields growing corn and soybeans for animal fodder to get shoveled down the guts of the gullets of animals. Most water in America goes to irrigate corn, soybeans, and alfalfa for animal flesh production. Most water is polluted with manure, herbicides, and pesticides from animal fodder production. Most species are going extinct because we're taking their own land and environment from them. And every year on planet Earth, they raise and slaughter 80 billion living creatures. Every one of them is breathing out carbon dioxide. They're all belching out methane. They're eating grains that have been grown with ammonia fertilizers. All of this puts greenhouse gases into the air. You can give solar panels and electric cars to everybody on planet Earth. But if we keep growing these animals and eating flesh as we are, nothing is going to help. Well, what about fish? Are the fish okay? The fish today, we've been treating the oceans like sewers, and the fish have all accumulated mercury and pesticides. Plus, we're clear cutting the oceans. We are strip mining the oceans, and we scoop everything out of every piece of meat, every piece of fish on your plate. You don't think about the dozens of seabirds that have been drowned, the whales and caught in the nets, the sharks, the rays, etc., the turtles. All of that is behind fish flesh consumption. If you're not aware of this phenomenon, the connection between meat and the environment, I urge you to read a book by Dr. Richard Oppenlander called Comfortably Unaware, which is just where the meat and dairy industry want us. You just keep eating those burgers. Don't even worry about where they're coming from. Oppenlander makes it very clear that we definitely should have some great concern. But what about this guy? He's saying something that we need to listen to. I tried eating vegan diet, it didn't work for me. I tried for a few weeks, I felt I didn't have the strength that I used to have, and then I ate some meat, and whoa, man, I felt great after that. Vegan, schmegan, man, I'm a carnivore. Boy, I need my meat. What's he saying to us? Is it that everybody either saying this got together and said, let's drive Dr. Klaper nuts, and we'll all tell him that we feel better when we eat meat. Or they're telling us something that we need to take into account. I think this is a true phenomenon. Does that mean that some people just need to eat meat? No. Here's what I think is behind this. Here's my theory of what's really going on. Where it all begins, I think, is where so much of medical issues begin, and that's who we are as in the earliest years of our lives. At age 6 months, the baby is still nursing on the breast or still sucking on the bottle. And with all the love in the parents' hearts, there's no blame here. Your mother didn't know, my mother didn't know. They just tried to give us the best nutrition going. But with all the innocence, ignorance in their heart, at age 6 months of age, that jar of baby lamb, baby chicken, baby turkey is open. And from that point on, 3 times a day, animal flesh is slathered on that child's intestinal tract, all through infancy. By age 2 or 3, they're in the fast food restaurant eating their Happy Meals. They are off to a flesh-based diet, all through infancy, all through childhood, through adolescence, through puberty, through their teens, their 20s, their 30s. You eat animal flesh 3 times a day for 30 years. You're going to create a body that is dependent upon it. How? Well, the intestinal mucus will set up to be the best mucus for extracting nutrients out of this high-fat, high-sugar, high-protein food stream. The liver enzyme is going to set up to be the most efficient for dealing with this high-protein, cholesterol-containing, high-sugar, low-fiber food stream coming up from the gut. And very importantly, your muscles make muscle-related nutrients, carnitine, creatine, myoglobin. Cool, your body makes it. But if those molecules are coming in 3 times a day, every 4 or 5 hours in the food you're eating, what do you think your genes that call for the creation, for the synthesis of carnitine or creatine, what do you think they're going to do? They're going to downregulate. Your blood is swimming with carnitine and creatine. It's always in your blood because you're eating it 3 times a day. Well, you downregulate your own production of this. So what? Well, 20, 30 years later, you go see Forks Over Knives, you read John Robbins' book, you join ACLM, and the plant-based light goes on, and plant-based guy. And that's great, it helps your arteries, helps the animals. But what have you done? You've done a 180-degree turn on your food stream. Instead of low in fiber, it's high in fiber. Instead of high in protein, lower in protein. Instead of low in fat, instead of high in fats, low in fat. And very importantly, all those preformed muscle-related nutrients, all that carnitine, creatine, go on. Now you gotta make your own right now. Most folks are able to gear up their production of these molecules pretty quickly, but a significant number on the bell-shaped curve out in the tails are, some may take a few weeks or a few months or years to gear up their enzymes. I had meat cravings for years after I became plant-based. It may take these folks a while, and during that time they draw down on their own stores of carnitine, creatine, etc., and they don't feel so great. And then they eat a piece of meat or salmon, and all those preformed nutrients from muscles wash through their tissues. Whoa, I feel great. And they do. But let's consider what we are watching. This is not normal human physiology. This is an acquired dependency that was created from feeding a human infant animal flesh 3 times a day since infancy. You created dependency on this, so what? This is not normal human physiology. Of the 400 plus babies I've delivered, 30 of them were to vegan parents, and I watched those 30 vegan kids grow up, nice and strong and healthy and bright. Married other vegan kids, people who have had their own second generation of vegan kids. They grow up just fine. Guess what? They don't have meat cravings. Their mouths don't water when they walk past a barbecue. They are different physiologic creatures. Most folks can make this change very quickly. Some may take weeks or months, and it's okay. Everybody is where they is, and it's not their fault. So what do I tell people who I find in this position? I tell them, listen, if you think your body needs some animal protein, and it does, and they're dependent on it, what to do? I said, fair enough, consider it medicinal. Like a vitamin tablet that's toxic in large amounts. You don't eat handfuls of multivitamins, don't be eating big slabs of steak. Find the smallest amount of animal muscle you think your body needs, about the size of a deck of playing cards. Eat it on Monday, coast on that Tuesday, Wednesday, Thursday, Friday, as long as you can until you think your body's getting depleted and you need a little more, and then take another hit of it, and coast on that as long as you can. Eat the stuff twice a week instead of 3 times a day. Just do that. And consume as seldom as you can, and try and work on extending the time between you eat the stuff longer and longer until eventually fades out of your diet altogether. This is how I handled those folks. I think they are telling you the truth, and they didn't ask for it, but they wound up with a dependency. Well, help them wean off of it. And if it takes 6 months or a year, fine. It really doesn't matter, as long as the majority of what they're eating is whole plant foods. Never count anybody out. You never know who's going to change, and it's not for us to deny our patients this knowledge or guidance. It's not for us to withhold this information. You don't know how everyone's going to respond when you give them this handout. And Ken was one of those guys. He came back to see me 3 months later. Doc, I followed your advice. You know, that handout was pretty handy. Man, I love that bean chili. I love those big salads. My wife makes some great salad dressing, no oil. And this can turn into that Ken, 12 weeks. 2 kilos later, got him off his blood pressure medication, off his insulin. This is what happens to people who follow your advice. Don't think that they can't. And so I come to this moment in the slideshow where I ask very challenging questions for doctors and dietitians now, especially in this country. Knowing that these are all reversible diseases, every one of these fearsome diseases that the majority of us spend the majority of our times in the clinic dealing with, knowing that these are reversible with a healthy, whole food, plant-based diet and a sane lifestyle, I have to ask the question, you want to heal these patients or don't you? Really, why don't you go into medicine? Are you going to decide that this isn't going to work for your patient? How dare we withhold this information? It's none of our business. Who decides to follow it, that's none of your business, doctor, but you at least owe them this information. And a referral to a plant-based dietitian who believes in the subject. And those dietitians, we need them to step up. And you should find somebody in the local hospital. There's some young dietitian who's a little bit open to it. Have her read the express edition of Becoming Vegan by these two excellent academic dietitians, Brenda Davis and Sana Molina, and learn about the subjects, because I want to send you patients. I need you on my team. Stop resisting this. This is medicine of the future. Please get on board this train. You are missing in action. Don't take no for an answer. They're bullying you. They need to join the team. They are equal members. Let's invite them to take their full role. And then there's this guy. You know, we've got to, when you walk in the room and you're first meeting the patient, you want to present a picture of health, of vitality, of someone who cares about them, compassion. If you're this guy, if you're angry and you're got a big pot belly and you've got a pocket full of statins and lisinopril, and you're and with a pack of Marlboros there, and you tell the patient you got to clean up your diet. You know, it's a pretty thin stance here. So you want to set a good example. Lifestyle medicine, again, have never heard of it till a few years ago. I sure know a lot about it now. And it's funny the reactions we get. When I tell someone I'm in lifestyle, that's California woo-woo stuff. No, doctor, it's the most powerful medical specialty of all, because it will cure these patients. Where the vascular surgeon is just messing around with their plumbing. You want to get a picture of that? You want to cure these patients, or don't you? Clean up their diet, their lifestyle. These diseases go away, and you owe that information to the patient. This is a disruptive lecture, and I tell the med students, I want medicine to look different to you after this talk. I want your body to look different to you, because once you look behind the curtain, you can't pretend you don't know what's behind the curtain. Yeah. And once you practice lifestyle medicine, you see these people getting healthy. You can't pretend you didn't see that. And the Australasian lifestyle medicine doctors seeing it, the Malaysians are seeing it, the Europeans are seeing it, there's just in Mexico, there's a Mexican College of Lifestyle Medicine. Everybody's seeing it. Don't tell us we're not. Tincture time is a powerful medicine. And when patients are sitting in my office with the classic diseases, obesity, diabetes, hypertension, and high blood pressure, and they're complaining about, Doc, how do I get this way? I'm sitting there watching, what would that body look like with 6 months, even 60 days of a whole food plant-based diet rushing through their tissues? This is the river of life. It's kind of a hokey analogy, but the water in this river is the water in the fruits and vegetables. That's what you want to pour through your patient's tissues, meal after meal after meal, month after month, and they turn into being healthy people. You see these folks emerge. It's the food is the food. Ask the patients, who does the cooking, who does the shopping in your house and the cooking in your house? Tell me the reality of your food scene. Do you eat out in restaurants every night? Do you fast food? Who does the shopping and the cooking? Find out. If they seem tentative, have them go to the Force Organized website. They have wonderful recipes, food plans, diabetes strategies. What else have I learned? Water fasting is a powerful modality to lower high blood pressure, cool off inflammatory joints, psoriasis. These long fasts over 5 days have to be done at a setting like TrueNorth, where these folks are monitored very tightly twice a day. But any healthy person can do 5 days at home, and it's good for just a general clean out. But if they've done a water fast for any of these serious conditions, a once a month, 3 to 5 day fast will keep them in remission, makes chemotherapy work better. There's a whole fascinating science behind water fasting. But the most important thing is what you eat after the fast. Because if they go back to their old diet, then everything comes back quickly. The person needs to eat healthy and live healthy after the fast gains are lost quickly. If you want more information, take a picture of this, call the folks at TrueNorth. They'll tell you if your patient's suitable for water fasting. The physician who's done the most research on this, Dr. Walter Long, goes down at USC. If you Google his name and plug in intermittent fasting or fast mimicking diet, or fast against sirtuins, molecules that turn off cancer growth, then you can school yourself about this. Okay, so what have I learned? I learned what my medical resident taught me as a third-year student. If you just shut up and listen to the patient, 90% of the time they're telling you the diagnosis. And if you keep listening, they'll tell you what treatment they need too. Some people have been scarred by life. You just have to accept that. And some of the inappropriate eating and drinking and smoking is their pain that's coming out. Listen to them and listen to why are you drinking like this? Why can't, what's with the smoking? You know, find out their why and come up with some suggestions that might help. And realize that there but for fortune go you or I, and compassion always pays because we can wind up in that same position very quickly as life unfolds. Follow-up is so important. The biggest regrets that I have in my medical career were the phone calls I didn't make to the patient, to the specialist. I didn't call back, find out how they were doing. Make that call. You'll avoid some of the major regrets in your life. It's the best way forward for our profession, and as I said, it's the only way forward for our planet. And don't resist this, and to our dietetic colleagues and the administrator, don't resist this. This is where medicine has to go to be sustainable, and if you've got kids, you've got grandkids, you want them to have a livable planet, we got to get serious about plant-based diet. So bring a positive force and bring lifestyle medicine to the mainstream where you are. Let the young students, your fellow professionals and your patients know about disease reversibility. That's such an important concept. I've never heard about these reversible diseases. Encourage them, don't settle for less. So how do you change people is the question of the day. You change a society by changing its culture, as we're told. Educating the people, you cajole them, hold up a mirror to them so they can see their own reality. The word doctor comes from the Latin word docere, to teach. We are teachers in our best role. And what we have to do is like turning an ocean liner and to change the society. It may take time, but strong intention and a persistent hand on the wheel will create that long, slow curve. And so no matter how bleak it may look right now, stay true to your truth. Be excited. You are shaping the future of medicine for everyone who comes after you, doctors and patients alike. And good news, you can be certain that your dietetic colleagues and your medical colleagues will greet your efforts every step of the way with words of encouragement and gratitude for your blazing the way into plant-based nutrition. Yeah. They say you can tell the pioneers by the arrows in their back. And no, you're probably not going to be greeted with words of gratitude and excitement from your colleagues and from the dietitians. But the Texas Rangers in the south of my country have a saying, there's no stopping someone who knows they're right and keeps on coming. And this is the reality. You're right in promoting this. Don't let anybody deter you. Don't let the sniping from the peanut gallery get you upset. And when you get rejected for your teachings, here's my suggestion on how to handle it. This is a short clip from a classic film called Red Beard by the Japanese producer Akira Kurosawa. This is Toshiro Mifune as Dr. Niige. She kept wiping and wiping until she had convulsions again. She's a young prostitute. 1946. The young doctor wants to give her some medicine. Drink your medicine. Drink it, your fever will go down. That's what they do with our advice. He gets discouraged. What can we do? How can we help her? Give up. She won't let me examine her. She won't take her medicine. Says the more experienced physician. See what I can do. That was administration responding to our plant-based request. There's a dietitian responding to our plant-based suggestion. Perseverance furthers. Perseverance further. She just kept coming back with loving suggestion again and again and again. And we're all going to have to play our roles with as much integrity and patience as he did. I left clinical practice. I need to be talking to the med students and give them the lecture I wish somebody had given me 50 years ago, that you're not going to be seeing smallpox and leprosy in the clinic, guys. It's what your patients are eating, and that's where the focus should be. So far this year, I've been to these universities, a bunch more to visit, and giving them a similar lecture to this. I was at Davie, Florida here. A young doc came up and said, this made me reevaluate everything. Good! That's the whole idea. We got to reevaluate what we're doing, and so I meet with the students to keep this information alive and to get it into their own curricula so I don't have to keep doing this. And so to everybody, to the doctors, the dietitians, everyone, just make it very clear, and this conference says it so beautifully, the year of applied nutrition-based lifestyle medicine is dawning. This wave is breaking. There is no holding it back. Be part of it. And both the clinicians and their patients are going to benefit greatly. So if you're not a member of ACLM, please do so and do as much as you can to get this information into your daily practice. Hopefully one or two of those things were of value to you. And if you have time for questions, great. If not, thank you for your attention.
Okay, dear colleagues, we have to reschedule a little bit our conference because now at 4 o'clock we will be in direct connection with our U.S. colleague, Dr. Michael Greger. So we need 10 minutes for technical break to make this connection, to establish this connection. So please stretch up a little bit, yeah, briefly, and exactly at 4 we are starting our
Klausītājs Heimuras atšķils savai ir kur Vai tas ir? Jā,